to make one point and then ask a question. I'm a big advocate for moving away as fast as we can from fee-for-service and moving towards value-based care. And I'm a particular fan of freestanding ACOs because we had two very, very good ACOs operating in Rhode Island, Coastal Medical and Integra. And I think that when the incentives line up for doctors to provide the best care rather than the most care, then things like telehealth can actually happen fairly naturally. In fact, we have experience of ACOs being willing to install telehealth machinery in patients' houses because it works better without having to get a special, it's just part of the overhead, essentially. So I think this represents one of many areas in which if we solve the fee-for-service billing nightmare and treadmill, a lot of good things will come. But I want to talk specifically about the TREATS Act and opioid and substance abuse treatment. The TREATS Act is mine with Senator Murkowski, but I think there are 6 members of this committee that are co-sponsors of it. And we've had, I think, 434 deaths from overdoses in Rhode Island. So really important to get the services out there that people need. One of our service providers is an excellent group called Kodak, spelled with C's, not K's like the old camera company, run by a woman named Linda Hurley, who's very, very good. And there's a client of theirs, a patient of theirs, who works, and the time that she can get for her conversations with her treatment specialist are her lunch hours. Now, if she had to go someplace and sit in the waiting room and wait and fill out the clipboard form for the umpteenth time and then hope to be seen and all that, wouldn't happen. Her sobriety is supported by these regular conversations she has, and they happen because of telehealth. Otherwise, it wouldn't work. She's a busy person. She has a busy schedule. Her employer is very strict about her being available when needed. So that's her window. And telehealth makes it happen for her and keeps her supported in her sobriety. So I guess I just wanted to ask Dr. Marotra a little bit about how you think telehealth is an advantage in dealing with the current opioid crisis and the terrible toll that it's taking.
No, I mean, I just thank you for that point. I just wanted to emphasize the issue that we have an opioid crisis, and telehealth can be that mechanism to get that care into for those patients where it's very difficult for them to get to their clinician. You told us about that story, but also where there is no one you can go to nearby that you can drive to get that care that you really, really need. And I also wanted to tie it back to what you were describing before really briefly, which is that I'm seeing some really innovative...
I talk about rural Rhode Island, but I think Senator Thune might think that I was kidding.
That there are some new payment models that are being used for opioid treatment programs, OTPs, as well as for opioid use disorder, where they're giving a monthly or weekly payment and saying, look, clinician, you do how you provide the care as you need it, and let's not get into that administrative burden of, this visit or that visit. So I think it's a really exciting space for innovation because we need it.
So you're actually tying my 2 points together, that payment reform and available telehealth makes a really good combination in terms of serving patients and reducing cost. Can't do better than that. Thank you.
Senator Young.
Thank you, Chairman, and thank you to our witnesses for being here today. I have to say, even prior to the pandemic,